Good afternoon, my friends. I'm very glad to see you again, and this is a continuation of our lectures of human anatomy. I see today 1, 2, 3, maybe 8 person who visited our lecture. Please let me know if everything good with the translation, because I had some drawbacks when I adjust this presentation, and I don't know if you are able to hear me clearly. Let me know just. Okay, Ahmed, thank you very much. That's good. So I am ready to start our lecture, which will be about venous system. We will talk about the blood vessels we call veins. Are you ready? Okay. Then I open presentation, and here as I said, venous system, this is the second system in our body, and veins are regarded as the capacitance vessels. It means they collect blood and transfer it directly to the heart. We call veins, we call vessels which transport blood to the heart veins, and in opposite to the arteries which transfer blood from heart to the different organs. And veins are vessels which have a relatively thin wall, and they have a flaccid wall. It means they have thin wall of the vessels, and it expands how veins can accommodate to increase volume of blood, because they collect, they may have much large volume, and they can consist more blood than much more blood than arteries. And in the final, I'd like in final feature of characteristic of the venous system, I would say that the veins can collect about 64% of the blood in our body. It means this is real containers. This is universal containers for blood in the body. What we will talk about, some issue, we will start from general characteristic of the venous systems. Then I'll tell you about vein classification, and give you a characteristic of systemic veins, and then we will discuss some systems of the vein. There are 4 venous systems: superior vena cava system, inferior vena cava system, portal system, and veins of the heart. In the end of our lecture, I'm going to talk to you about anastomosis. Anastomosis is the connection between veins, vascular anastomosis, and we will finish with the fetal circulation. This is especially options, especially features of the system circulation in fetal period and then after birth. Let's get started. Firstly, I'd like to give you characteristic of the venous systems. And as I said, veins are great collectors of the blood in our body. They take blood from organs as well as from the wall of all cavities in the organism, and they return the blood to the heart. This is the main characteristic of the veins. As you see, some of special features which are different in veins. First feature is that the thickness of venous wall are small. This is the thin vessels, and the second option is that the wall of an artery will contract, but the veins usually doesn't contract. It is not possible to make the lumen. This is the space between walls in the vein, and usually vein are not contracting vessels. Vessels lining, the endothelial lining. I hope you remember that the internal layer of the veins we call endothelial layer, and this lining is flat. In veins, the endothelial lining is flat in comparison with the arteries, which have some folds in the endothelium. Veins doesn't have such folds. And one interesting and main difference from the veins different from arteries is that veins typically contain valves. This is special structures inside of veins which manage the stream of the blood in only one direction, from organs to the heart. They prevent coming back. They prevent backflow. We call it backflow of the blood. So that is a very good characteristic and very and it is necessary for standard circulation in our body. A couple of words I would like to say about veins function. First function, that is a common function for all vessels, that is a transport of the blood. As I said, veins transport blood from capillaries to the heart. Deposition of blood, that is the second feature. And really veins serve as a great tanks, like a great container of the blood, and sometimes they are able to contain more blood than in arteries, in 2 or 3 times greater. When can regulate of blood circulation in organ, and they can contract, but that is not such a good, such as a distinguished option like in arteries. Arteries are more contracting vessels than veins. Veins are main collector of all limbs. We have there are another, the third system, third vessels system in the body, which we call lymphatic vessels, and all lymphatic vessels transport the lymph. This is a special fluid inside of lymphatic vessels, and this fluid transports and all lymphatic vessels come into the veins. That is another function. Different receptors. There are different receptors located inside of veins, and that they will be osmo, chemo, and baroreceptors, which help to regulate the blood circulation and the common blood pressure in arteries and vein as well. And this sixth function is production of hydrolysis protein, carbohydrates, mineral salts, and liquid may be absorbed in veins, part of the microcirculatory bed. So the largest and the first. Okay. This is also may serve as nets, as vessels which collect difficult mineral and organic elements from the microcirculatory beds. Well, as I said, there are some factors which help the blood flow through the veins. As you see, the first idea that veins are thin-walled vessels, and so during muscle contraction the blood can pump in one direction, and it is like we use some balloon, which we put balloon in hand and press it. It is the same mechanism and the same idea how muscles help blood flow in the veins. And another factor is the arteries. Arteries have special pulsation. You know that the large arteries may be large during heart contraction, and during we call it during systole, heart systole, and then during heart diastole they their diameter, artery diameter became small, and this pulsation help transport the blood in veins as well. And the third factor is the this is the respiratory pump when we exhaling and inhaling. So that is the help. It's make pressure inside of thoracic cavity to be less than atmospheric pressure, and during inhaling it helps the blood transport in the vein. It is like it works like a pump, sometimes like a vacuum pump helps. So 3 factors of venous blood flow. The interesting symptom we can observe in some patients which have special works, like that is works during when people have to stand long time, like surgeons, operators, and sometimes the blood stay in the lower limb veins, may give enlarging of veins, and that called varicose veins. It visible because more often these varicose veins are located under the skin, so the veins, varicose vein, enlarged veins are visible, and it get problems for people because such varicose vein may have thrombosis, and that is a real danger for their life, because the thrombus can transport from the vein directly to the heart, to the right atrium, then to the right ventricle, and then to the lung vessels, and it may it make embol in the lung vessels, and that is a very dangerous situation for people. So I always recommend to the patient who has strong varicose vein, who has such symptom, come to the doctors, come to the surgeon, cardiovascular surgeons, and operated such vein. And as I said here, the potential risk of thrombosis inside of varicose vein. Here you see this the already formed thromb inside of veins. Well, some feature of veins structure. In comparison with the arteries, there are usually two type of veins, two group of veins: superficial and deep veins. Here in the picture you see the superficial veins are colored by blue, but in deep veins this is the dark blue, light blue and dark blue color. This is a difference. Mostly we can see superficial vein under the skin in upper and lower limb. Sometimes we can see such superficial veins on our neck, and they are also visible in the on the anterior abdomen of the abdominal cavity, the anterior wall, of abdominal cavity. And venous plexus are found mainly of internal organs that change their volume. A lot of internal organ like bladder, uterus, rectum, stomach have special venous plexus, which special venous system, this is organ venous system or plexus, which are collected blood from this organ. Especially we could find such organ in our pelvis. In cranial cavity, there are special construction venous vessels we called sinuses, because the brain has typical veins, but the blood from these veins come into the sinuses, and these sinuses get unstopped, non-stopped process of transport, because interruption of brain circulation in vein and artery, this is a danger for life. Next, what our topic is classification. How we may distinguish which vein we can distinguish. Firstly, this is a two group of veins which are located in the systemic. Everything is okay? Все хорошо? Угу. Ну, нашел ты или нет?
Да, сейчас. Я какое-то сообщение написал тебе, наверное, прислал.
Он где-то здесь ходит или нет?
Он зашел, он в подъезде стоит. Сейчас.
А что нужно тогда?
Надо ему код показать.
Давай, покажи сейчас. Давай.
Сейчас все пошло.
Да, скажи. Давай. Sorry. So we distinguish the veins in the systemic circuit or large circuit and the veins of pulmonary circuit. This is the same like in artery. The great circuit and small circuit. This is the two big systems, and we distinguish such also and veins. What is the difference between veins in the systemic circuits and pulmonary circuits? In the systemic circuits, veins transport deoxygenated blood, but in the pulmonary circuits, veins get oxygenated blood, and that's why we usually draw these veins with the red colors. Talking about the systemic or great circuits, we distinguish small veins, medium veins, venous sinuses like in the brain, and large or systemic veins. They distinguish in the this is the main idea of this classification. It is the diameter of veins: small diameter, medium diameter, some sinuses, and the large veins. It is three main veins in our body. Here you see systemic veins in the body. Firstly, this is the superior vena cava. Here you see superior vena cava. It formed from brachiocephalic veins and collects blood from the heart, neck, upper limb, chest, and chest organ as well. And and it transports the blood into the right atrium. The second vein system is inferior vena cava. That is large blood vessels is formed from two common iliac veins and collect blood from firstly from the lower limb or lower extremities, small pelvis organs, organs of abdominal cavity, as well as liver, and the inferior vena cava comes into the right atrium, as well as superior vena cava. So this is a two great vein in our body: inferior vena cava and superior vena cava and inferior vena cava. Okay, get it. Then the third systems. This is a portal vein. Vena porta is formed from splenic vein from the superior mesenteric veins, and sometimes from the inferior mesenteric veins. These venous systems collects blood from unferried abdominal organ, such as the stomach, spleen, pancreas, duodenum, and other parts of small intestine, large intestine, and partly from rectum. This is really great system which transport the blood into the liver, where blood when the liver is an organ for detoxification. The main function of liver is detoxification of the blood in the portal system. Why only portal vein come into the liver? Because sometimes students don't understand why it needs to transport all blood from the internal organ of abdominal cavity to the liver. I can explain it because we eat a lot of food, and food stay in the lumen of small and large intestine, where lives bacteria and microorganisms, and they take this food and eat it and produce some of toxic ingredients, like it may be when you forget some food in room temperature for 2 days, special soup and porridge, and the microorganism start to eat this and produce very toxic substance or toxic chemicals. And if these toxic chemicals come into the blood directly in the great circulation, great circuits, it may be poison. It spoil the body very fast. So liver is organ protects the body from these toxic substances. Okay, this is the portal venous system, the third venous system in our body. And the smallest venous system is the coronal system, which is located in the heart. The heart as an organ has got a special blood circulation, and heart has coronary arteries and cardiac veins, and these cardiac veins come into the structure called sinus, coronal sinus. Here you see this structure on the posterior surface of the heart, and you see also the cardiac veins come into the cardiac systems. That is the smallest venous system in our body. Let's take a look and see which are how superior vena cava systems works, and which kind of veins are connected with these systems. Superior vena cava, you see it here. This is a superior vena cava. Quite short vessels. These veins are. This vein is not longer than 8 centimeters, and usually its diameter is about 20-25 millimeters. As you see, 2 veins form superior vena cava, and these veins we call right, here is right, and left brachiocephalic veins. We don't forget about these veins, because very often students during examination forget about these veins. They remember superior vena cava and remember subclavian and jugular internal veins, but don't remember such important and great veins like brachiocephalic veins. What is the sources of blood coming into the superior vena cava? As you see, these vessels receives blood from thoracic and abdominal wall, head and neck organs, and upper limb as well. This is the sources of the blood. When blood flew from this and come into the superior vena cava. As I said, the forming structure for superior vena cava are brachiocephalic veins here, and for brachiocephalic veins, we would say that they are formed from internal jugular, here as you see internal jugular veins, and subclavian veins come together and join together. They form brachiocephalic veins, right? And here the same idea we could see and for the left brachiocephalic veins. And some of veins come into the brachiocephalic veins. We call it tributaries. Tributaries for brachiocephalic veins are thoracic veins, lowest thyroid veins, thymic veins, and mediastinal veins. They come into the short brachiocephalic veins. Some of the vessels form internal jugular veins, and this is external jugular veins, and some veins come into from the face, you see it here, from the neck and from the brain. The internal jugular veins, as a like vessel, has a continuation of the from the sigmoid sinus. It forms on the level of the basic cranial basic and forms and take blood from the sigmoid sinus. This is a collection of blood coming from the brain, and brain into the internal jugular veins come from the brain, from the face, from the neck, from the inner ear, from the eyes, and even from the intraosseous vein. All of these organs and body parts have small veins which come into the internal jugular veins, and we call such veins the tributaries of jugular veins. This is very important veins because it collects blood from the brain. During the pressure of the internal jugular veins, usually followed by the stopping of brain circulation, and it give a problem for the people. Here you see venous sinuses which form the collectors mostly all blood coming from the brain, and such collectors we call sinuses. Here you see sigmoid sinuses, which is tributaries for internal jugular vein. Here you see a straight sinus, superior sagittal sinus, inferior sagittal sinus. The sinus located around thela turcica, called cavernosus sinus. This is important sinus which has tributaries from orbita, and blood from the eye come into cavernosus sinuses, and another parts of the brain give the blood to this oval-shaped vessels, sinus, and other. Well, as you see, other cerebral veins and numerous small veins from the orbit drained into the sinuses, and then sinuses transfer blood to the sigmoid sinuses. It is possible because of there are two petrosal sinuses which connected the cavernosus sinus and the largest sinus called sigmoid sinus. Here you see joined the point of joining this superior sagittal sinus and transverse sinuses. The blood come in this direction, to the right or to the left, and then come into the internal jugular vein. Here you see right internal jugular veins and left one. Another tributaries or route for brachiocephalic veins is the vein called subclavian vein. This vein is a collector for all blood coming from upper extremities, and here you see superficial veins coming into the subclavian vein directly, especially this is the cephalic veins, and small subcutaneous veins come into the another veins in the brachial veins, and a lot of deep veins of the upper extremities also coming together and join together, transport blood to the subclavian vein. As vessels which is before subclavian veins, there is axillary veins, and it get blood from brachial veins, deep veins, and this vessel, I mean brachial veins, get blood from the radial and ulnar veins of the antebrachium part of the body. Next systems is inferior vena cava systems. This is the most thick, sorry, I don't know why it is in Russia. Let me try to load. Maybe this is some mistake. Just a moment. I don't want you. Oh, let's try again. No. Something. Let's try again. Okay. And check the correct English version. Well, that's good. So, okay, this is the English. Inferior vena cava is quite thick vessels, and it is located on the posterior part of the trunk in abdominal cavity usually, and we call it retroperitoneally. It means it is located on the posterior part of the abdominal cavity. What is the sources for inferior vena cava? This is the two paired veins called common iliac veins, right and left, which form the inferior vena cava on the level of the vertebra, lumbar vertebra number 4 or 5. This is a point point of forming inferior vena cava, and these roots we call vessels forming the veins we call vein roots. So roots for inferior vena cava are common left and right iliac veins. Inferior vena cava receive blood from different and mainly a lot of organs give the blood to the inferior vena cava, such as the abdominal wall, such as the organ of the pelvis, and especially lower limb. And this is quite large parts of our body. So the diameter of inferior vena cava is bigger than the superior vena cava. We distinguish parietal and visceral veins, like tributaries of inferior vena cava. We distinguish parietal and visceral. What does it mean? Parietal come from the walls of abdominal cavity, but visceral veins are coming from the internal organ inside of abdominal cavity. Firstly, I'd like to give a characteristics of parietal tributaries of the inferior vena cava. This is the lumbar veins. You see such veins coming from the vertebral column, coming from the venosus network around the spinal cord. This is also phrenic veins, which collect the blood from the muscular phrenica or diaphragm, and all of these tributaries are parietal tributaries because they come from the abdominal walls. Visceral tributaries of the inferior cava get blood from testicles. Here you see testicles. In women, this is the ovarian veins. Then renal veins come into the superior vena cava. Adrenal veins, this is the organs located on the upper surface and superior surface of the kidneys, and this is endocrine glands located. This is part glands located here, and they also have veins coming into the superior vena cava. And very important veins of as a tributaries of inferior vena cava are hepatic veins. This is the veins coming from the liver after blood was detoxicated inside of liver. It form hepatic veins, usually 3 or 4 hepatic veins, and transfer these veins into the inferior vena cava. Here you see the forming inferior vena cava, and you see the two common iliac veins, and they is formed as well from the external and internal iliac vein. It is quite large vessels, and usually they collect the blood from internal iliac vein, collect the blood from internal organ, pelvic internal organ, but external iliac veins is the vein collector from the lower extremities, and they come together and join together on the level of the sacroiliac joint, right and left. This is the level, and then continue with a short common iliac vein, right and left, and form the largest vein in our body, inferior vena cava. Talking about lower limb extremity veins, we have the same idea for superior extremities, and we distinguish superficial veins for lower legs and deep veins. What is the difference? The same situation like for upper extremities. We distinguish the superficial veins located under the skin, and we call sometimes they as subcutaneous veins. But deep veins accompany arteries and usually located deep between muscles, and they accompany arteries all the time. In lower limb extremities, we distinguish two great superficial veins. First is great saphenous vein. Here you see it, and it take blood from mostly all parts of lower extremity, but also we have the small here. I'm sorry. This is a deep vein. It was my mistake. Here is a great saphenous vein, which come into the femoral vein, femoral deep vein, and we have the short superficial veins called small saphenous vein. So there is great saphenous vein and small saphenous vein. They are located on the lower extremities. Deep veins start from the fingers. Then they form plantar veins, then metatarsal veins and tibial veins, forming also popliteal veins located on the posterior side of knee joint, and transform later into the femoral vein, the largest deep vein of the lower extremities is the femoral veins. I forgot to add that all of these deep veins have the same name as the arteries. We call femoral artery, and femoral vein accompanies this artery. This is the same principle we see in the different part of lower extremities. The portal systems. Here you see portal vein. This is a quite large venous vessels, forming usually from two large veins of abdominal cavity. The first root of hepatic vein of portal portal vein is splenic vein, and the splenic vein, and the second root is superior mesenteric vein. Here you see this vein. Sometimes it may be 3 roots, but more common when inferior mesenteric veins taking blood from the distal part of large intestine come directly into the splenic vein, and then splenic vein form together with superior mesenteric vein form vena porta. Vena porta has also some tributaries. These are veins transporting blood from organs of superior level of abdominal cavity. And here you see the gastric veins, here gastric veins, pyloric veins, superior gastroduodenal veins, cystic veins coming from the gallbladder, and some other small veins taking blood and come into the portal veins. As I explained before, the circulation systems of the liver is a difference in comparison with other organs. Here you see the portal veins or vena porta transport the blood from organ of abdominal cavity, and then it is the only vena have branches. Usually arteries have branches, but only one vena in our body, and it is the portal vein has branches which transport bloods into the liver. This is a different small and smaller branches, and then the blood come into the capillary net together with the artery blood, and this in the hepatic tissue the blood is mixed. This is venous blood and arteries blood coming together. It is necessary because artery bring the oxygen, but veins bring the nutritions and toxic substances which must be deactivated, and this role is the main function of the liver. Then capillary net coming together and form hepatic veins, join together and form 2, 3, mostly more common 3 or 4 hepatic veins. You see it here, 1, 2, and 3, which form the tributaries for like a vena hepatica, form the tributaries for inferior vena cava. But blood into these hepatic veins, blood doesn't contain toxic substances. They leave. They are left in the liver and detoxicated with some biochemical processes inside of this organ. Here this explanation of liver blood circulation. It forms from portal systems and arterial systems, and then after circulation in micro vessels, forming venous systems of the blood. Sometimes we find connection between veins of portal system and caval systems. We call these connections anastomosis, and we call them intersystem anastomosis because they collect different systems of vein. Here you see in green, this is the portal systems, this is the system of inferior vena cava, and here a system of superior vena cava. This connection located in the different part of our body. We can find such anastomosis on the anterior abdominal wall. Here, this is a superficial and sometimes deep veins of the anterior abdominal wall. They also located on the esophagus, because the most part of esophagus gets blood from superior vena cava, but the lower part of the esophagus, where it is connected with the stomach, this is has blood circulation, venous blood circulation from portal systems, and this is also place for for located such anastomosis. And the third circulation is the third anastomosis located on the rectal intestinal or the rectal. Here you see also porto-caval anastomosis. Sorry, not porta. This is a cava-caval anastomosis located on the anterior abdominal wall. Why I told you about intersystem venous anastomosis? Because we have one disease called cirrhosis here. This is a post-viral disease which transform hepatic tissue into the connective tissue. It looks like what does it mean? What does it look like? Like a lot of bulbs on the surface of liver. And usually cirrhosis after hepatitis, this is a very dangerous infection disease, may transform in the small liver, and it comes to the pressure of portal vein inside of liver, and it comes to the increasing pressure in portal systems. In such situation, usually all anastomosis became larger and visible, such as it's visible on the esophagus, and it is like a esophageal varices, and sometimes they may be hot, and it comes to the unstopped blood leading, and come to the death of patients. And another symptom during portal hypertension, we call this symptom of increasing pressure inside of portal system, we called portal hypertension. It is a result, we could see enlarged veins on the abdominal surface, and we call it Medusa's head, because like a Medusa, Gorgon Medusa has a high hair of this is a snake instead of hair, and it looks like a snake, like a Medusa's Gorgon Medusa head on the abdominal wall. It is not beautiful, it is not attractive at all, but it is danger, because it combined with the acid. You see the large abdomen, and because blood couldn't come to the liver, and it is some of the part of the blood come into the into the abdominal cavity and supported by the enlarging of the abdominal. The fourth system, venous system, is the coronal sinus systems, which characteristics the cardiac veins have. They are quite large, and the numbers of the cardiac veins are more than the arteries. We distinguish the great or large vein. Then we distinguish medium and small cardiac veins. All of these veins come into the coronal sinus. Here you see coronal sinus, and coronal sinus come into the right atrium. In additional to the large, middle, and small cardiac veins, we see the oblique vein of the left atrium and posterior vein of the left ventricle. So there are 5 great cardiac veins coming into the coronal sinus. This is important to know, especially for cardiac surgeons who operated on the heart. And in the end of our lecture, I'd like to show you the special features of fetal circulation. I would say that there are 3 periods of intrauterine development when the embryo has yolk period of circulation. That is a very short period when yolk as a source of nutrition has small primary vessels. Then we can find allantoid circulation, and it is also short, not a long period. But the main period when form placenta, it is a special organ in between fetus and uterus, and this is the placental circulation period for fetal circulation. What does it mean, placenta? Placenta is a child place. Sometimes we call it in Russian child place. this is the organ regulation which regulates the blood circulation and the changing of oxygen, carbohydrate, and nutritions, and some of unnecessary vessels. And this is only one place where fetus can take oxygen and nutritions from the mother body and give to the mother the products which the fetus doesn't need anymore. Here you see the special structure between placenta and fetus, and we call it the pupovina, or the umbilical cord in English. And umbilical cord consists of one large umbilical vein and two small umbilical arteries. Here you see arteries. They are blue, and red color has umbilical vein. Why artery are blue and vein are red? Because vein transport oxygen from the placenta to the fetus, but arteries transport the deoxygenated blood, only with a lot of concentration of carbohydrate, and that's why we form and draw these arteries as a blue vessels. Here you see the special changing of circulation inside of placenta. You see the arteries come into the placenta and have branches, which is a small circulation. We call such parts of placenta like forcines, and then the blood from forcines come to the veins and form placenta umbilical veins. Placental circulation is usually stop coming some of the nutritions like proteins, and it's possible to transport proteins, but sometimes it is also such as the substances like alcohol, narcotic drugs, pesticides, or toxic chemical can pass through the placental wall, or placental barrier, we call it, and this is the danger of this is a potential danger for fetal. So usually doctors strongly don't recommend to drink alcohol, to smoke for during the period when the women are going to be a mother. And what is then the difference in the circulation? You see here the umbilical cord and umbilical vein come into the fetal body. This is the place which we call umbo, in the centrum of anterior abdominal wall, and then one of the branch come into the liver and another branch come into the inferior vena cava. Why it is necessary the blood come firstly into the liver? Because liver during the fetal period of time serve as an organ producing the blood cells, and that's why the new blood cells come into the blood, and then through the hepatic veins come back to the inferior vena cava. Then the blood come into the right atrium, but there is special fold here which direct the blood through the interatrium septal to the left atrium. Especially during fetal period, between left and right atrium there are oval window here. It formed secondary, and it is used for transporting blood from vena cava inferior to the left atrium, because lungs for fetal doesn't work. They don't have air, so the most concentrated oxygen concentrated blood come directly to the right atrium. Another blood coming into the right atrium from superior vena cava here come into the right atrium and then come into the pulmonary trunk. Another special feature of fetal circulation is that pulmonary trunk is connected to the aorta by the way of the arteriosus ducts. This is the small and short vessels which we call sometimes bottle of vessels. This is a connection which help the blood not come to the lungs, but come directly into the great circuits, because small circuits during fetal period of time doesn't work at all. And so please remember that during fetal circulation, I show you it again, this is the two special option in the heart. This is the oval window, and this is the ductus arteriosus. It helps to avoid blood coming into the pulmonary circuits. Then here you see all features of fetal circulation, what I just have told about, and you see here what happened after a newborn. When child come to this world and the umbilical cord was cut, and no connection between placenta and body of the fetus, but it immediately start to breathe. The fetus, the newborn, makes the first inspiration and immediately start the pulmonary cut. It is the beginning of circulation in the pulmonary circuit, on a small circuit. The blood comes into the lung, and there is a change in between blood in the lungs. The oxygen come in the blood, carbon oxygen come out, and blood, and this is like typical circulation for adults. But in some period after the birth, the oval windows closes. Usually it takes about 6 months when the connection between left and right atrium is closed, and also you see the closed ductus arteriosus, or bottle of ducts. It is also happened after 1 month after birth. Of course, the pulmonary, placenta or umbilical vein is closed, and here you see only a ligament. This is it transforms in ligament venosus. This is obliterated ligament, as well as the tersely or round ligament on the anterior abdominal of cavity. Here you see the circulation of before and after birth, and the processes which happened immediately just the child come in this beak and intestine ward. Okay, here this is all for now, and as usual I'd like to thank you for your attention, my friend, and I'd like to remember you that we have the special test today. Don't forget to pass this test. You have time till 20 hours. You have more than 4 hours to pass this test, and we will know your activities in this lecture. If you have question, you also can leave your question in our forum in the Moodle, or during your practical lessons. You can ask your teacher about what you don't understand with the fetal circulation or with the venous systems at all. Thank you again very much. I hope we will have another 2 lections, and I wish you to be good health, and spend your weekend very interesting. Thank you, and see you next lecture. Goodbye.